This presentation is called Understanding the Basic. School neuropsychology is a discipline that is growing in popularity in universities and subsequently in public schools. School neuropsychology assessments are substantially more extensive than traditional psychoeducational assessment reports. The reports are discussed at the student's individual educational plan or IEP meeting, and educators and parents are present at the meeting. It has, however, been a very difficult field of studies for teachers, school administrators, and other educators to understand. It is often viewed as too overwhelming and too complex to grasp. The purposes of this presentation are to help educators understand the information that comes from a school neuropsychology assessment report and to apply that knowledge to assist in planning appropriate supports for the child. A school neuropsychology assessment is usually conducted with a special needs student who, for one reason or another, is in need of a more in-depth assessment than a traditional psychoeducational assessment. The assessment is usually conducted by a school psychologist with training in school neuropsychology or a clinical psychologist with training in school psychology. A teacher, school administrator, designee, parent, and other educators need to be present at the IEP meeting. There's many areas that are looked at in this school report, and I wanted to go over a couple of them. One is what's called fluid, and this includes the broad ability to reason, form concepts, and solve problems using unfamiliar information or novel perspectives. One of the assessments that we use, or that can be used, is the WISC-5, and it has different subtests. One of the subtests that looks at this is what's called figure weights, and the student or client needs to look at this scale, and there's a question mark here, and then we need to try to figure out, well, what would weigh the same as this little red circle? And I have these options 1, 2, 3, 4, 5 down here, and I would want to pick number 2 or the other red circle. Those would probably be equal. As we move along, the tasks get a little bit more difficult. Here again is the question mark. I need to try to figure out, well, what would go here? What would be the same as 2 circles? And I have this first one to help me, and then I can pick either 1, 2, 3, 4, or 5. And then it even gets more difficult. So the tasks go in ascending order of difficulty. I need to pick which one of these would be appropriate to place here where the question mark is. Another assessment that we do for this fluid reasoning is what's called matrix reasoning. It's very similar to the other task. What we need to do is we need to put something where this question mark would be. What would make sense? What would I put here? I can pick 1, 2, 3, 4, or 5. I would probably want to pick number 3. It seems like the red circle would go here. These are what are called reasons. When we look at this one, here's the question mark right here. I need to look and see, is there a pattern developing? What would go here? And then I could pick any one of these. Again, this one's very difficult. Again, I look at what's given to me, and I have to try to reason or figure out which would go here. Is it 1, 2, 3, 4, or 5? And another thing we look at in these types of assessments is what's called working memory. The ability to hold information in immediate awareness while performing a mental operation on the information. We usually look at working memory in 2 formats, auditory and visual. And when we do auditory memory, the WISC-5 has a really nice subtest called digit span, and it looks at working memory by giving digits, and the student or client has to repeat them either forward, backwards, or in a sequence. In this case, it's from lowest to highest. And then another type of memory, that was auditory memory, another type of memory, and this is where the client or student is shown a picture, seconds, and then they need to say, hey, which one did I just see? So they would say B. I saw this one, the flower. It gets more and more difficult. Now they're asked to remember 2 objects. They don't have to know, it's not just remember them, but the order too. So they have to know that this is first and that's second. So when to know that the sock was first and the apple, so they would need to respond with BA. Again, they're looking at these two objects and they need to recall them. They need to be able to remember them. And you have to remember which one of these was first, which one of these was second. Then it increases the number. Here's three objects here. The student has to remember all three of them, and the represented here, they have to pick out which one is which. What was the order? Another area that is looked at is what's called verbal comprehension. And verbal comprehension measures the student's ability to access and apply acquired word knowledge. Specifically, this score reflects the ability to verbalize meaningful concepts, think about verbal information, and express oneself using words. A couple of the different subtests that are used in the WISC-5 are vocabulary and similarity. For vocabulary on the WISC-5, they would have to simply define words. For example, what is a flower? What is island? What is ancient? What is... And then a different subtest is what's called similarities. In this particular top one right here, how are red and green similar? So the student would need to say, well, they're both colors. How are winter and summer similar? Oh, they're both seasons. And then they would ask, how are knee and ankle similar? How are demand and request similar? Another area that we look at is what's called visual spatial skills. That's the ability to perceive, analyze, synthesize, and think with visual patterns, including the ability to store and recall visual representations. One of the subtests is what's called block design. In this particular subtest, they're given 4 blocks, and they would look at this pattern, and they would need, with their 4 blocks, the blocks, you can have a red side up, a white side up, or even a red and white side up, and they need to make this design. Here's another example. Okay, with these 4 blocks, let's make this design. And to make it more difficult, they could be given 9 blocks, and then they would make this design, and they would want to do this as fast as they can. Another area is visual spatial skills, and this is another subtest on the WISC-5 that looks at visual spatial skills. It's called visual puzzles. And there's a puzzle at the top of the page, and this puzzle has 3 pieces. It has a yellow rectangle here, a purple rectangle, and a large purple square here. And now I need to go down and I need to find these 3 pieces down here. I can say them in order. So I could say that this large purple square is number 6, this purple rectangle is number 2, and this yellow rectangle is number 1. Hey, I found them. It's 6, 2, and 1. Another example of the same subtest, I need to find these 3 down here. So I would look for them and say the 3 ones that I think make up this puzzle. Here's another example of the same thing. I need to find 3 pieces down here. Another area that a neuropsychology assessment could look at would be what are called social emotional skills. And one of the most common ones that we give in the schools is called the BAS-3. This is a little look at the BAS-3 when it's scored. And so what I want to do in this is just read the different areas at the bottom that could be looked at. Now, this could be looked at attitude towards school. This is the student version. Attitude towards teachers, sensation seeking, school problems, atypicality, locus of control, school stress, anxiety, depression, sense of inadequacy, somatization, internalizing problems, attention problems, hyperactivity. This one right here is inattention and hyperactivity. This is the behavioral symptoms index. This over here on this side over here, this is relations with parents, interpersonal relations, self-esteem, self-reliance. So the way to read this is if the dots are around this 50 line or the middle line, then the student is viewed the same as their peers. If they're up here in this at-risk area, then that should be a concern. And if the dots are up here, some of these are. Those are what we call clinically significant. Those would be areas to look at. This is the student version of the BAS-3. Another assessment that we can look at this particular assessment is called the Connor score. It looks at attention, but it looks at several different areas, and this could be given to the student, it could be given to the student's parents, it could be given to the student's teachers, and they're going to rate the student on inattention, executive dysfunction, hyperactivity, impulsivity, emotional dysregulation, depressed mood, anxious thoughts. These are some of the areas. And then it's really easy with this write-up to read. The guideline here, these are average scores. It gives the percentile if you want to look at that too. And so this is another really nice area to look at, which is the social emotional area. And then there's another assessment that could be used in a neuropsychological school report. And this particular instrument is a different instrument. It's called the Comprehensive Executive Functioning Inventory. And it's really nice because it looks at what's called executive function. And here's the breakdown of this. And then this is the scoring right here. It would tell you if these are average scores, low average scores, high average scores. But these are the different areas. So this is really interesting to look at the different areas that it does measure. It gives a full scale score on executive functioning, but it also gives an attention score, an emotion regulation score, a flexibility score, inhibition control, initiation, organization, planning, self-monitoring, and working memory. So this is a really nice assessment to give also. It looks at all those different areas. And so in summary, the school neuropsychologist will usually report the scores on clusters such as these that I've gone over at the individual education plan. It's called an IEP meeting. That's the meeting for the student. The school educators, parents, anyone could look at strengths and weaknesses among the cluster scores. And a very important part of the report is how the student's strengths and weaknesses are linked to recommended interventions to help the student succeed. That concludes my presentation. Thank you very much.